will be aligned with the midline of the pelvis and trunk, and then the moving arm will be aligned with the lateral midline of the femur in line with the lateral of the condyle. Okay, what's normal range of motion here? So I'm trying to think. The way I learned.
Should we hedge bets to see how many people actually have 20 degrees of extension?
So the way I learned it in school is if you have them flex their knee too much, then you might get rectus femoris limitation. So go ahead and try to lift here. I think so. You're basically supposed to do it with the leg, with the knee relatively extended, I believe, right? So that's one common mistake. Okay, just make sure that you have the knee relatively extended. So what I'm going to have her do, what I want you to do is I want you to keep your hips and pelvis level here on the table, okay? I want you to drive your heel straight up towards the ceiling. I don't want you to turn your leg in or out, okay? And I want you to try to keep all this here relaxed, okay? We're not trying to engage any of these muscles here. I just want you to lift it. It is. Okay, relax. Go ahead and relax till I'm ready. So when I'm saying go, you're going to lift it straight up towards the ceiling and I'm going to measure. Relax. Okay? I'm going to find a greater trochanter. Normal range of motion is 20, okay? And a lot of us have tight hip flexors from all the sitting that we do, the modal posturing. Go ahead and bring your heel straight up towards the ceiling and hold it, hold it, hold it, and relax. I don't know why I said to hold it on a range of motion measure. 10 degrees of extension, hip extension.
He's trying to make us feel better.
Because if you had an extra hand, you would have done both tests at once.
I would have. She can hardly get through normal range of motion. She's not trained. You can turn if you want for so you can give that leg a break. Okay, same goniometric landmarks. Short range of motion. Knee should be relatively extended. Cue the patient on what not to do. I find that most people's tendency is to bring their pelvis up to try to get extra motion. You go ahead and flip your head up here and prone for me. Pillow, you're welcome to have one. And go ahead and scoot towards the edge for me. I think this is kind of a similar situation with the sideline hip abduction test, where you can test with a longer lever arm, but I think the standard is to test just proximal to the knee joint. So what we're going to do here, I'm going to have you bring your right heel straight up towards the ceiling as much as you can. Keep your knee relatively straight, okay? We're trying to get this muscle here to fire, your gluteal muscle. Keep your hips and pelvis level here on the table. I'm going to put a little pressure right here. I'm going to try to reduce compensations here by trying to keep the pelvis down, and I can also, so one of the tricks is, because the gluteus maximus is so large, and that's the prime mover here, I can stabilize the pelvis, and I don't have to feel the muscle here. So I can actually feel the most superior fibers of the muscle fire underneath my index finger right here. So go ahead and lift, so I can feel those muscles fire. I don't need to do a full-on palpation. I can see it fire because it's so large, and I can catch just the most superior fibers. What's the matter?
You keep calling my gluteus maximus large.
It's called maximus for a reason.
It's the powerhouse of the body, right? That's a compliment, by the way, from a physical therapist. I mean, I want someone to be like, hey man, you're stacked. Alright. Alright, so what I want you to do, I want you to bring your heel straight up towards the ceiling. I can feel it fire. I'm stabilizing here. Hold it right there, and let it go. Okay. Most people, like I said, because of by nature, we do a lot of training in the sagittal plane. I don't see a lot of major discrepancies in hip extension. However, if this is a young athlete, I've seen it done before, where someone will do the long axis MMT just to make sure that they are really ready to compete at the highest level. Go ahead and bring your heel up one more time. I've seen people do it down here, and that's not easy. That's pretty good. So the standard prone, stabilize, not over the muscle, but close, just that top level of the fiber, and you're going to apply the force just proximal to the knee. Any questions? Any comments? Questions?
I just want to make sure you have the form down also for passive range of motion when you're doing this. So before you test
Oh yeah, I forgot.
range of motion. You're gonna take someone through passive range of motion. Don't hurt yourself. Use good body mechanics. If you're gonna come in and lift someone's leg, which is heavy and doesn't have a super long leg, which is nice, but a lot of your patients will have long, heavy legs. Make sure you're coming under the leg, under the knee, cradling the leg, holding on here, and using a good stance to lift. So all I'm doing is cradling her arm. My upper body's not doing so much work as me flexing at my knees.
You meant cradling the leg.
Cradle the leg,
At
yes.
the arm.
So, but I'm not doing as much work at the arm
Got
as
it.
I'm cradling.
You got it.
Her
She's
leg.
moving through her legs. To
Yes,
That's
yes.
the range of motion.
So that's when you're taking